Hello everyone. Today we're going to talk about how to rank your emergency medicine program. My name is Nick. I'm a first year emergency medicine resident, and right now, being at the end of October, it is a fun and nerve-wracking and exciting time for people in their fourth year medical school as they're going through interview and then having to rank their programs. It's a lot to navigate, and when I was doing it, I didn't really feel like I had a good framework for it. I was mostly just reading Reddit posts and Student Doctor Network, trying to piece together any information I could. So I thought I'd make a video to kind of go over the framework that I used. So I'm going to go over a couple of different criterion that helped me create a map of how I was going to rank them. So the first is the subjective parts of a program. This will be your interview experience and your resident and faculty interactions. So how did your interview experience go? Was it well organized? Did you feel like you connected a lot with the program? Did you like how it was set up? People seem cordial, and were the interactions all good? And could you see yourself being there? That's a big thing to consider. And I know that now with most interviews, I believe still being online. I know for me at least, all of them were online. It can be a little bit difficult to gauge, but you should still be able to pick up some very useful information from the whole interview process and just your interactions with program coordinators and other residents if they had an online social, or if you were lucky enough to go in person or do an away there. Those are things that I would consider in this part of it. Also, how do the residents and faculty interact? Keep in mind that when you do residency, you're going to be in this place for, in terms of emergency medicine, 3 or 4 years. That's a lot of time to spend with the same amount of people. And what type of environment would you like to train in? Do you like a more hierarchical environment? Are the residents and faculty more collegial and informal? Those are all things that factor in, and those are kind of subjective on how much those matter to you and what type of environment you prefer. The next would be more objective criterion, and this is actually has a subjective component because a lot of this depends on what your goals are. Do you want to work in the community? Do you want to do fellowship? Do you want to work in academics? Those are all certain things to weigh when it comes to this. And if you want to do fellowship or work in academics, you'd want to know what the academic reputation of the program is. Does it have name recognition? Does it have a large alumni network? Do they have the fellowships in-house? Do you have those training experiences? Do they have a track record of getting people into those fellowships? Those are all things that you're going to want to think about if that interests you. Now, in emergency medicine, fellowships typically are not super competitive. In other fields, I know, for example, internal medicine, they're going to be a lot more depending on which ones. But it's still good to go to a program that has those built-in connections, and more importantly, gets you exposure into those fields and helps you kind of facilitate those relationships that are going to be beneficial. Then the curriculum and training focus. What appeals to you about each program? Now, do you have a interest in EMS, for example, pre-hospital care? Go to a program that has a strong track record in those settings. Do you like toxicology? Do you like sports medicine, geriatric medicine? These are all types of fields that you'd want to have a good connection to get into, but more importantly, you want experiences because you really want to solidify that that's what you want to do, and getting the connections in that field is huge because getting into fellowship is important, but a lot of the times you want to have those connections for when you get out, and you want to have kind of a lot of ins in different places. That's definitely preferable to not. And then for the alumni network, how big is it? How expansive is it? Do they go across the whole country? Are they more geographically consolidated? And if so, is that an area where you see yourself practicing or living for the long term? And segueing off that, the third criterion is the geographic location. Is it proximity to family? Or do you desire to live in this area? Does it align with what you like to do outside of work? For example, if you like to rock climb, you may want to go to residency in a place that has rocks to climb. If you like to mountain bike, you might want to go in a place where you can ride your mountain bike. These are all things to consider because apart from just the training, and I know that residency, it's a lot of training, we like to think about that part of it, but your whole life's going to exist there for the next 3 to 4 years. So you're going to want to be in an area where you can see yourself thriving in the hospital, classroom, and outside of it. You want to be happy. Work-life balance. Did this program have the type of work-life balance that you're looking for? And I know a lot of people will be like, well, aren't they all roughly the same? I mean, you're going to be working a lot of hours in the hospital. Yes, but certain programs are going to have more obligations outside of that. Some are going to have more social required activities. So think about kind of what type of balance you want, and different programs certainly do have differences in the amount of work hours. And we'll talk about that in the next section. And that is what I like to call the X factors. So in the X factors, think about the fit and culture. Does it feel like a good fit? Did you like the program? Did you like all the people there? Could you see yourself there? Kind of tying everything together. And then here is one. How is EM viewed at the institution? EM is not viewed the same at all institutions, especially some academic institutions. EM might not be viewed as highly as other specialties because at the end of the day, in emergency medicine, you are creating work for other people, and how much academic support do they have? That is something that can be difficult to gauge. I highly encourage you to really consider this point though. I think it's very important and can really shape kind of how your experience will be at the hospital throughout your residency. Shift schedule. What shifts do they work? Some programs might be 15 12-hour shifts a month. Some might be 21 10-hour shifts a month. Some might be 28-hour shifts a month. Those are variable, and that's highly individualized on which you might prefer. There is no best. For example, some people may value more days off, others may value more time off. Not just with the amount of shifts and hours. Another thing to consider with how are the shifts set up? Are you doing a calendar month or are you doing 4 weeks? That varies institution to institution. How are the off-service rotations set up? Which experiences do you get? Do you have elective ones or are they standardized? What about moonlighting? Can you moonlight second year, third year at all? And don't just ask about moonlighting and do you allow it. Ask recent examples of residents and how they have moonlighted and what jobs they've taken. I interviewed at one place and they talked about how they allowed moonlighting and told me the criterion. And then when I probed and asked, can you give me some examples of the shifts that people are moonlighting? They admitted to me that no one had been moonlighting since before COVID because they just didn't have any opportunities in the area. So that dropped them from me because that is something that is important to me. What is a sign-out culture? Are you expected to work the entirety of your shift, seeing new patients the whole time? Or are you, for example, working a 10-hour shift and you stop picking up new patients at hour 9 and work on disposition and getting all tests ordered? That can make a difference because if you're working the whole entire time, you're probably going to be there till after your scheduled shift. So what may look like a 9-hour shift may turn into, especially at the beginning when we're not as efficient as interns, closer to an 11-hour shift. But say you're scheduled for 10 hours and you stop seeing patients at hour 9, you're probably going to get out a lot closer to that 10-hour, especially as you get more efficient and more familiar with the documentation systems and the workflow in that institution. Another thing that I want to kind of touch on here that I think is important is the overall clinic and environmental factors, and this can vary a little bit. So, patient population and pathology. I think this is something that people overlook a lot. For example, where I went to medical school, I loved it. It was just not diverse. It was about 90% Hispanic in the area, so there was going to be pathologies that I just did not see. So that's something that I sought out in my medical residency, was going to an institution that had a much more diverse population. For example, throughout medical school, I did not see sickle cell. Here in residency, my first, 2 months of my intern year, I think I saw it 5 times and had to learn to manage that pathology. That's just one example. That would have been something I would not have been familiar with when I graduated and went out and started practicing. So think about how diverse the population is. And the main reason to think about that is because you want to see as much pathology as you can when you are studying and learning and have that oversight. And then clinical sites. Is it one site? Is it multiple sites? Multiple sites, some people like, some people don't. I personally like, and where I am doing my training, it is multi-site. And the reason is because of this. You get to see more pathology and become more familiar with the pathology. And you get to see it in a more advanced state. For example, say you work at a place that gets a lot of transplants. You're going to get really familiar with how to manage a lot of the immune modulating medicines. If you work in a place that is a cancer center, you're going to get familiar with different cancer complications, different cancer treatments, how to manage that. And the same with working in a women's hospital. That is important to learn those unique intricacies of different populations and pathologies, because once you get out into the community, you might get faced with pathology that is somewhat rare to typical emergency medicine, but you're still going to be expected to manage. And a lot of people worry a lot about trauma, for example. But in talking with a lot of emergency medicine doctors, I've been told that trauma is something to, you want to be very competent at doing that, but most places will get you competent. The things that you really want exposure to are the sick, medically complex patient and children. So make sure you have a good longitudinal children experience and you get enough complex pathology. And going to a place that has multi-site centers, especially when those centers specialize in different areas, that can be a great way to get that. Another reason, especially in an academic center, that I prefer multi-site is because there'll be a lot of different fellowships and residencies, and that kind of leads to some competition for procedures. But if you have multi-site, some hospitals may operate more as a community type setting, so you get a lot more of the hands-on experience. So you kind of get the best of both worlds in that scenario. Also consider the resident autonomy. Do the residents have graduated responsibility, meaning each year they get a little bit more, or are they kind of thrown in right away? There's pros and cons of both. And that, again, that's highly individualized. It's going to be, what are you more familiar with? Or I shouldn't say familiar with, but more comfortable with. So I hope that this video gave you some framework and how to think about it. So just to kind of recap real quick. First is the subjective. That's kind of your interview experience, how people interact. Objective, and this is kind of dependent on what you want to go into. Again, as a name recognition, fellowship opportunities, the curriculum and training focus, alumni network, and geographic factors. Is there a location you want to be? Do they have connections in multiple different areas? Does this geographic area align with your personal interests? And could you see yourself living there? The clinical and environmental focus, multi-site versus unisite, or singular site, patient, population, and pathology, and the resident autonomy, and then the X factors that I like to refer to. And that was the fit and culture, which is self-explanatory, how EM is viewed at the institution, the shift schedule, how those are lined up, and the sign-out culture. So if you found this video helpful, I hope that you take something from it. I hope that you have a great rest of your interview season and the rank list comes together well, and that you can sit down and think about that and come up to a best decision for yourself. And then a match day, I think it's in March. Everyone, I'm hoping we'll get the really good news. It's a very exciting but stressful time. Please do not hesitate to reach out. If you have any questions, leave a comment, give a like. Thank you, and good luck with everything.